Your brain starts sending out warning signals years before anything shows up on a doctor's test. Not warnings about memory, not confusion, not forgetting names, quiet signals. In your hands, in your eyes, in the way food tastes, in something as simple as how you button a shirt in the morning. And because none of these feel like brain problems, almost everyone ignores them. Today, I want to walk you through 5 of them, one at a time, so you know exactly what to look for and what to do next. Stay with me through all 5, because number 3 surprises almost everyone. Pull out a piece of paper right now if you have one nearby. Write your full name and address, the way you normally would. Now look at it. Is it the same size as it was 5 or 10 years ago? Or have the letters gotten smaller, closer together, a little more crowded on the page? Neurologists actually have a name for this. It is called micrographia, and it happens when certain brain circuits that control fine, precise movement start to change. You might also notice it when you are buttoning a shirt, or picking up something small, like a coin or a pill, or when you try to write quickly, and your hand just does not keep up with your thoughts the way it used to. On its own, this could simply be arthritis or normal stiffness in the joints. But when handwriting shrinks and gets crowded without any pain, it is the kind of thing worth mentioning to your doctor. Not with alarm, just as a quiet note. Your hands have been doing this your whole life without you thinking about it. When the brain changes, the hands often show it first. The second sign is not about smell. It is specifically about taste. Has food started to seem a little flat lately? A little less satisfying? You are eating the same meals you have always enjoyed, but something is missing. Or maybe you have noticed you are simply not hungry the way you used to be. You skip a meal and do not even realize it until late afternoon. The pleasure we get from food and the appetite we feel are closely tied to specific brain systems, the same systems that can begin to shift quietly in the early stages of cognitive change. The pattern to watch for is a gradual loss of interest in food, especially foods you have always loved. Not because of depression, not because of a stomach problem, but simply because food has started to feel less rewarding. Your family might notice before you do. They might comment that you are eating less or that you seem disinterested at mealtimes. Take that observation seriously. A simple question to sit with is this: when was the last time you genuinely looked forward to a meal? Now, here's the one that surprises people the most, and this is the third sign. Your vision itself might be perfectly fine.
You passed your eye test. Your glasses prescription has not changed much, but something feels slightly off when you are reading, or when you are driving, or when you are trying to follow a moving object, like a bird crossing the garden, or a grandchild running across a room. What researchers have found is that the eyes themselves are often perfectly healthy, but the brain's ability to quickly process and interpret what the eyes are seeing can begin to slow down. This shows up as difficulty reading a line of text smoothly. Your eyes might skip back, or you lose your place more easily than before. You find yourself reading slower, even though you can see the words clearly. It can also show
Show up as a slight hesitation when you are navigating through a familiar room or finding your way around somewhere you know well. Now, this is absolutely something to discuss with your eye specialist or your doctor before drawing any conclusions. But if you have been told your eyes are fine and something still feels off about the way you take in the world visually, that is worth a conversation. Your brain does most of the seeing. Your eyes are just the camera. This next one takes a little honesty to recognizing yourself. Think about the last time something small frustrated you: a slow driver, a piece of technology that would not work, plans that changed at the last minute. How did you react? And more importantly, how long did it take you to settle back down? One of the quieter early changes in brain health is not about memory or thinking speed. It is about emotional regulation, the ability to manage frustration, recover quickly from irritation, and stay patient when things do not go as expected. People sometimes notice that they are quicker to snap, or that small things bother them in a way they never used to, or that after something upsets them, it lingers longer than it should. They simply cannot shake it off the way they once did. Now, stress, poor sleep, loneliness, and chronic pain can all cause similar changes, so this is not a diagnosis, but it is a pattern worth paying attention to. The question to sit with is this: am I the same person I have always been emotionally? Or have people close to me mentioned, even gently, that I seem quicker to frustration lately? The people who love us often see these changes before we do, and their observations matter more than we give them credit for. The last sign is the most subtle of all, and it does not mean getting lost in a new place. It means feeling slightly disoriented in a familiar one, like going to the supermarket you have been going to for 20 years and for a moment not being sure which aisle has what you are looking for, or walking through your own house and turning the wrong way down a corridor you have walked 1,000 times. Or parking your car somewhere you always park and having a brief moment of uncertainty about where you left it. These moments are easy to brush off. You were distracted, you were tired, and that may well be true. But if they are happening more often, not occasionally, but regularly, and specifically in environments that should feel as automatic as breathing, that is a pattern worth noticing. Our brains build detailed mental maps of the spaces we use every day. When those maps start to feel blurry at the edges, it is one of the quieter early signals worth taking seriously. Not a reason to panic, simply a reason to check in. So there they are: shrinking handwriting, food losing its appeal, visual processing feeling slightly off, emotional reactions that are harder to manage, and moments of disorientation in familiar places. None of these on their own means something is seriously wrong. Any one of them could be explained by a dozen other things: stress, poor sleep, vitamin deficiencies, medication side effects. But if you have been sitting here recognizing two or three of these, especially if they are new in the past year or two, and especially if someone close to you has noticed them too, then the right move is simply to book an appointment and say, I want to talk through some changes I have noticed. That conversation gives you options. It gives you time. And time is the one thing that makes all the difference when it comes to brain health. You noticed early enough to act, and that matters more than you know. If this video was helpful, please share it with someone you care about: a family member, a close friend, a neighbor who might need to hear this today. And if you would like to know about the everyday habits that researchers believe protect brain health the most, I have a video on exactly that linked right here. Take care of yourself. And I will see you in the next one.